Did you know that your body may be alerting you right now that your blood sugar may be elevated? When your blood glucose levels are over normal but not high enough to be diagnosed as diabetes, you might not be aware of it. This condition is referred to as prediabetes. Why then is prediabetes a major issue? This is due to the fact that prediabetes is completely reversible, but that eventually 75% of those who have it progress to full-blown type 2 diabetes. More than 88 million adults in the United States have prediabetes, and 90% of them are unaware of their condition, according to statistics. That equates to more than one-third of adults, or they choose to ignore the symptoms, sometimes for months or even years, by dismissing them as minor health issues. However, diabetes is far from a minor condition, and early detection and treatment can make the difference between a long, healthy life and a life filled with health issues, including nerve damage, kidney disease, heart disease, stroke, and blindness. We'll discuss the top 12 prediabetes symptoms in today's video. Make sure you stay tuned until the very end because some of these symptoms will really catch you off guard. So let's get started straight away. Higher than normal blood glucose levels. Blood glucose levels that are higher than normal are signs of prediabetes. This indicates that the hemoglobin A1C level is between 5.7 and 6.4% and that the fasting blood glucose levels is in the range of 100 to 125 milligrams per deciliter. Impaired glucose tolerance, impaired fasting glucose, or IFG are other names for prediabetes. Number 11. Unexplained tiredness. Insulin resistance, which occurs in people with prediabetes, makes it difficult for the body to effectively turn blood glucose into energy. Fatigue without cause is the outcome. Even when they are not physically exerting themselves, they could feel worn out. Number 10. Wounds heal slowly. Over time, prediabetics may experience sluggish wound healing. Poor circulation brought on by high blood sugar can harm the lining of your tiny blood vessels. Small wounds and bruises may therefore heal more slowly than usual. Number 9. Inexplicable mood swings. Mental wellness requires normal glucose levels. An individual becomes more tense, agitated, irritated, and unable to concentrate when there is an excess of blood sugar in the brain. Stress makes it more difficult for insulin to function correctly, which causes blood sugar levels to rise. However, these symptoms frequently go away when blood sugar levels return to a normal range. Number 8. Hunger and weight gain. Losing weight is the only thing that can truly help prediabetes, but it is tougher to achieve when blood sugar levels are consistently high. Because insulin-resistant cells find it difficult to absorb glucose from your blood, sugar levels rise. You eat more as a result of insulin resistance, increasing your appetite. An increase in blood glucose tells your pancreas to produce more insulin. However, additional insulin triggers your body to store the extra sugar as fat, continuing the vicious cycle. According to additional studies, prediabetics who enjoy evening activities, stay up late, and get insufficient sleep gain more weight. Even a small amount of weight loss, 5 to 10%, can drastically lower blood sugar levels. Number 7. Frequent urination, excessive thirst. Your kidneys are renowned for being able to reabsorb all the blood sugar and restore it to your blood vessels when your body has an excess of glucose. As a result, sugar causes your body to produce more urine, which increases your frequency of bathroom visits. As a result, your body starts to seek more water, which makes you continually thirsty. It's a never-ending cycle. Because they consume more caffeine, those who drink coffee and tea could urinate more frequently. In the absence of this stimulation, frequent urination may be a sign of prediabetes. Number 6. Numbness and tingling of feet and hands. Prediabetes have been linked to nerve degeneration and fiber damage, according to studies. Impaired glucose tolerance or IGT and neuropathy appear to be related even in the absence of the onset of type 2 diabetes. Prediabetes is present in a significant number of people with idiopathic neuropathy, and it is present in a significant portion of people with peripheral neuropathy. Before we move on to the next fact, if you have enjoyed our video this far, subscribe now and hit the notification bell to get updates about health and wellness. Number 5. Issues with digestion. Researchers have shown that persons with prediabetes experience more gas, bloating, early satiety, nausea, heartburn, and constipation. This might be the result of long-term chemical alterations to nerves brought on by high blood sugar that harm the vagus nerve. Food remains in the stomach longer than it should when the vagus nerve is damaged because it controls how quickly your stomach empties. The medical term for this is gastroparesis. The best course of action is to have a doctor perform a pre-diabetic examination if digestion problems persist or cannot be accounted for by dietary choices and other factors. Number 4. Aching joints. Pre-diabetics tend to be overweight, which puts additional strain on the joints, especially those in the lower body, and raises the risk of osteoarthritis. According to a recent CDC analysis, arthritis affects 32% of persons with prediabetes. About half of persons with prediabetes and arthritis also have obesity or are physically sedentary, which raises the risk of developing type 2 diabetes according to the research. Number 3. Skin conditions. Acanthosis nigricans, a blocked region of skin that feels like velvet on the back of your neck, armpit, groin, or elsewhere, may appear in some people with insulin resistance and prediabetes. Another sign of high blood sugar is the presence of skin tags on the neck, groin, armpits, and eyelids. Number 2. Blurred vision. Your risk of vision loss may rise if you have prediabetes. Retinopathy is the result of swollen eye lenses brought on by high blood sugar levels, which make it difficult to focus. When your blood sugar levels return to an ideal range, the haziness vanishes. After a diagnosis, this symptom is frequently connected to prediabetes. Number 1. Kidney damage. Prediabetics frequently have undiagnosed chronic renal disease. In a sizable investigation, it was discovered that kidney disease symptoms were present in more than 1/3 of prediabetic individuals. Additionally, renal disease is in a stage 3 or 4 similar to that of diabetes. The 5th stage is the worst. Either dialysis or a kidney transplant are required. Do you have any of these signs or symptoms? What steps are available to reverse prediabetes then? Prediabetes and type 2 diabetes can both be reversed using the same techniques. Here are some tips to lowering blood sugar levels and losing weight. Cut added sugar and sugar substitutes. For a good list of nutrients such as dietary fiber, omega-3 fatty acids, including alpha-lipic acid, berberine, magnesium, zinc, chromium, and vitamin D, eat whole and processed foods. Get regular exercise. A daily vigorous 30-minute walk will do wonders. Get enough healthy sleep, practice good sleep hygiene, reduce stress, and maintain hormonal balance, including insulin. Track your development. Finally, who is at risk for developing prediabetes? If you are older than 4 to 5 years old, have a large belly, practice a sedentary lifestyle, or have a diabetes in your family. To determine whether you have prediabetes, think about being tested. If you liked the video, give it a thumbs up and share it with your friends. Let us know in the comments down below. Do you have prediabetes symptoms? Have you ever been tested for prediabetes? If you want more educational facts and tips, subscribe to the channel.